Morning, Tina.
Morning, Dr. Phillips.
I was born and raised in Weatherford, Texas, which is a small town of about 12,000 people, which is about 30 miles west of Fort Worth. I attended Baylor University and graduated with a Bachelor of Science in Biology. For as long as I can remember, I've wanted to be a doctor, probably starting at age 6. My aspirations were to be a doctor, and now I feel like I'm living a lifelong dream. I was able to be of some help to my father in assisting with calls while we were running the ambulance service, so I spent a lot of time in hospitals and in emergency rooms and in contacts with doctors, and always had a drawing or just an interest in medicine, starting, like I said, at a very young age. After I graduated from Baylor University, I went to medical school at the University of Texas here in San Antonio. After I graduated from the University of Texas Medical School, I went to New Orleans at Charity Hospital, where I did a rotating internship. Medicine is changing at such a rapid pace, it really presents a challenge for us to keep up in our field. The way I found best for me is regular reading of journals, interactive video conferences, continuing medical education seminars, which are offered either locally or outside the state or in various locations. And by keeping abreast of these changes, I find it enables me to take care of almost any problem that comes in our door. So during my time of practicing family medicine, it became apparent to me that many patients need to see us without the luxury of scheduling an appointment. So I had this idea that we call express care. And express care is an open walk-in opportunity for patients to come in and see one of the doctors in our group for whatever medical problem it is that they may want to bring in. It's been a great satisfier to our patients, and feedback is patients really love it. One of the common problems that we see in family practice, especially here in San Antonio, is care of a diabetic patient. I enjoy taking care of my diabetic patients and find that with a good teamwork approach between my directions and the patient's compliance with those directions, we can almost always keep the complications of diabetes under control and avoid serious problems. Presently, I have a patient in the hospital that I've taken care of for 15 to 16 years who went to the hospital with some serious medical problems, which became more complicated during their hospital stay. I called in the necessary specialists and consultants to have him taken care of, but I still go by daily, and I truly believe that whether it's just a familiar voice or a comforting touch, that patient knows that I'm there with them during this time, and I believe that does assist in the recovery from this illness. Well, having grown up in a small town, I've always envisioned myself as a country doctor, and I try to practice that way even though I live in a large urban city. So I'm constantly aware of the expense of medical care, the burden that it places upon our patients to get medical care. So I try to practice medicine every day with a common sense approach and use the training and the ability that I have, and not just rely on high-tech, sophisticated testing to answer every question that a patient may present with. My duty to my patients is to develop a rapport and to nurture a trusting relationship with those patients. Patients trust us when they come and seek care from us, and I believe that the care of that patient must always reflect that privilege that they've placed with us to help care for them during times when they're sick, and fortunately in my practice to help do preventative things to to help keep them from becoming ill.